Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Amazing.
That's a lot. Yeah.
That's amazing that it's that high that for 13 to 19, which suggests that they're not exercising and they're
Right.
overweight. Yeah,
Oh,
overweight.
gosh.
And developing pre-diabetes, which if not corrected will wind up with diabetes, which is a disease that you don't want to get unless you have to have it. You know, some people have no choice, but when you start with pre-diabetes at 12, it's problematic.
Yeah.
So, Dr. Callender, type 1 diabetes you're born with, is that true?
Yes, for the most part. Now, as people in this group know, there are adults who develop type 1 diabetes at later age, at 20, 30, and 40. But most of type 1 is a consequence of what happens early on, whether you're born with it or whether the beta cells are killed by a virus after birth. But very young is type 1 diabetes. And type 2 is that which traditionally develops after you over 40.
Dr.
But
Callender,
now we're seeing this kind of type 2 between the ages of 13 and 19 because of the pandemic and some of the lifestyles.
my daughter is an example of a person that got type 1 an adult. She got type 1 above age 22, 24, somewhere like that, right after she got out of the service.
Right, and that is a problem we're seeing far too often now. Adults who are in 20, 30, and 40 who develop type 1 diabetes, because that's the hardest type of diabetes to treat.
Oh my goodness.
Dr. Callender, what's the difference between physiologically? What's the difference between type 1 and type 2?
The difference is that type 1 is related to the fact that the beta cells in the pancreas, which are responsible for secreting insulin, are destroyed in type 1 diabetes, which means you have to be on insulin. Type 2 diabetes, you have developed antibodies to insulin. And so you have insulin, but you have antibodies to it. And so that's why you develop diabetes. So that's the difference. Type 1 is the beta cells are destroyed, and type 2 is related to the fact that you've developed insulin resistance. Your body's developed insulin resistance. So that's the basic difference between the two.
Dr. Callender, a pancreas transplant is the solution to both types?
Well, type 1, it is definitely the solution. For type 2, often diet and weight loss can be the solution for many. Whereas for type 1, about the only absolute cure is pancreas transplantation.
My goodness.
Any other questions about that? Because I think it's a topic that, and when you see somebody has type 1 as an adult, if it's not diagnosed and treated properly, it can cause many problems, especially low insulin levels. Low glucose levels, which can be fatal. So.
Halle Berry got diabetes at 30.
Say what again?
The actress Halle Berry got diabetes at 30.
That's type 1. Yeah, she's doing well considering. Yeah.
Yeah, because she said that was actually the best thing that happened to her because she wasn't taking care of her health, and now she became more health conscious.
Yeah, she's looks great for somebody as she ages. Yeah.
Yeah. Yeah.
And also, Dr. Callender, I've been seeing in the recent in TV, the insulin is so expensive.
Absolutely. Well, of course, it just passed a law to make make the level at which you charge for insulin be dropped to $35 a month, I think. But
Oh, that's good.
the court is, the Senate, the Congress of the United States has just passed a law that prohibits them from making insulin so expensive. But you're right, it has become very expensive.
We have
Dr.
an article.
Callender, I've been having some problems with my leg, especially my foot, numbness. And I went for a Doppler test, and they said the blood flow is great. And they're trying to figure out why I'm having this. And they said if I was diabetic, they would consider it to be peripheral neuropathy.
Yes.
And I said, I've been told in the past that I was pre-diabetic. So they're sending me now for blood work.
Yeah, hemoglobin A1C is what you need to get. That's the blood test you need to have because the blood sugar doesn't really help you know whether you have diabetes or not.
Okay.
But the hemoglobin A1C will give you a best measure of that. But pre-diabetes would not give you that peripheral neuropathy. That's more likely related to something else.
Right. And I was told in the past I was pre-diabetic, but could this mean now that I'm diabetic? If I was diabetic?
I doubt it. I doubt
Okay.
it, but the test will
Okay.
bear it out. Hemoglobin A1C will tell you.
Okay.
If
And that's the next
if
step.
it's lower than 6, you're okay. If it's higher than 6, then you're no longer pre-diabetic, you're diabetic.
Okay.
Dr. Callender, I just got my A1C back and I was 5.8.
Good,
That's
good,
nice. Yeah.
good,
But I've been working on it.
good. Keeping it
Good.
at 6 or lower is wonderful.
Don't forget what the podiatrist said. You know, if you're sitting for long periods of time, that can affect your feet as well. So stand
Yeah,
at least once every hour.
I do have peripheral artery disease. I'm being treated for that too.
Mm.
Yeah, and that's what she was ruling out. That's what the Doppler rules out because
Right.
that requires different treatment, as you recognize, whereas the peripheral neuropathy can be treated by medications that are special for that. But and it has a lot of different causes.
Okay.
Okay, now John, you can start showing. We have a number of issues that we wanted to share today. I've got to leave by 10:30, so John, you can get started. This is something that we've talked about on the group for some time, and what is disturbing is that you've asked this question. Well, since you know it's going to happen, you're going to have an epidemic of mental illness after the pandemic is over or during the pandemic. What are we doing to prepare for that? And the tragic answer is, as far as I'm concerned, nothing.
Yeah.
And it's tragic. But as we look at mental illness, I think I was pleased that Joe Biden brought it out in his presidential address. That's one of the areas that we have done little about. And one of the things that we recognize is that racism causes so many mental problems.
Yes. Yeah.
That sometimes we don't appreciate it. In addition to the fact that we have the stigma of getting mental health treatments, going to the psychiatrist.
Yeah.
And so it becomes very critical that we understand. And that's why when we talked about suicide earlier this year, and we talked about what to do with somebody who was suicidal, and we talked about not leaving them until you've taken them to get help. This then is becoming more and more a problem. And people are recognizing that when somebody tells you they've got a mental health problem and they've considered suicide, it cannot be taken lightly. And it is clear that people in the LGBTQ community have an even greater problem than others. And so it's interesting that whatever way you're different, it causes people to be uncomfortable, whether it's because you're too beautiful or too homely or whatever it is. It can cause, and then of course, the problem with abuse and being associated with abuse, seeing abuse, being abused, all of that contributes to mental illness. And so you see these numbers on the hopelessness. It rose from 26 to 37%, and then now it's up to 44%. So that's an awful high. And it says that we have a problem that's affecting our youth and is killing our youth. So more in girls than boys, but it's incredibly high in all.
Dr. Callender, you know, if you are severely racist, that's also a mental illness, isn't it?
Yeah.
Well, yeah, and you know, it's something that Martin Luther King talked about many decades ago, that racism is an illness that affects those who are racist and those who are subjected to racism. So that's a good point. Well, so you have to keep that in mind as you deal with your grandchildren and children that they're depressed, they're not open, that they may need mental health and seeing a psychiatrist. Seeing a psychiatrist isn't always that easy, but it's something that's important. One of the reasons is that some of the psychiatrists don't accept insurance.
Yeah.
And you have to pay cash, and so that is a disincentive to many people.
Yeah, you were speaking about the prom. You know, some high schoolers didn't even get to have a prom because of the pandemic.
Mm-hmm.
Yeah.
Is that bad or good?
I think it's bad because, I mean, you know, that's one of the things they look forward to the most, having that prom, you know, going out.
So much so until I'm waiting for my invitation to graduation. I got an invitation to the prom send-off. So go figure. Go figure. I'm telling you, everything's different.
That's interesting.
It's a new generation.
I think one of the things that they said in that article, and parents and grandparents, you know, teenagers go through that period of where they want to be by themselves and isolation and etc. And I know one of my children, you know, growing up, they want to be by themselves, and doctor said, oh yeah, they need that privacy. But I felt they didn't need that privacy. They needed to intermingle, keep that door open, come and active. Even if they don't say anything to the family, they need to be around people. And that interaction is what really helps the family. Since families no longer have meals together, parents have to say, even if we're just sitting up here doing nothing, come and be next to me, around me. Our society has grown so that everybody has their own room. I think our mental health was better than you cram all 8 of your children in one room where they had to have socialization. They didn't have any downtime to be by themselves.
That's right.
And you had to be stuck up underneath your parents all the time because there was no room to be by yourself.
Only at school.
And you know, going to school, interacting, even if they were loners at school, when you came home, you had to be around the family. And so I think all of us should understand that even though teenagers rebel and they want to be by themselves, the best thing for them to be is around everybody else. listen to you, talk to you, hug them even though they don't want to be hugged. I know we can't kiss them, but just make them be around you,
Really.
all in one room. You may go crazy, but it'll help them.
Yeah, that's true.
Dr. Callender, do you have any idea of whether the late Dr. John Robinson was overwhelmed in his practice?
No, he was not overwhelmed practice.
Okay.
No, he was the only thing he was overwhelmed with was his heart condition. Yeah. Okay, moving on. This is a good article that talks about stomach symptoms you should never ignore because they signal many kinds of diseases, many of which are lethal. Prolonged diarrhea, of course, losing fluid can kill you. So if you have consistent diarrhea, then you become dehydrated and you get many other positive things. It's also true that this is one of the signs of COVID. And so the dehydrating influence of diarrhea is important to deal with because you have to drink many fluids in order to survive. Blood in your stool under any circumstances, whether it's bright red, maroon, or black, is something that needs to be treated. It may be one of the first symptoms of colon cancer. Of course, if you've had a colonoscopy, that should eliminate that as a possibility. And everybody over 45 should have a colonoscopy. Severe cramps after eating is a sign that something's wrong. And irritable bowel syndrome is something that is not uncommon. And if you have that, that needs to be treated as well. Difficulty swallowing, esophageal cancer and other esophageal problems. And of course, if you can't eat, you can't live. So when you have trouble swallowing, then that needs to be diagnosed and treated. Unexplained weight loss, especially if accompanied by abdominal pain, but unexplained weight loss that is not induced by yourself because of some reason becomes an issue because it's often related to inflammatory bowel disease or cancers. And then, of course, chronic constipation, with or without pain, is something that needs to be dealt with. Because you should have at least one or two bowel movements every day. And so when it gets longer than that, you need to make sure that everything's okay. Without question, if you have severe abdominal pain, this can be a sign of diverticulitis, appendicitis, and other diseases that require surgical intervention or require just treatment in the hospital. So you can't just say, it's just pain.
Excuse me, Dr. Callender, what is that diverticulitis? I've heard it before.
Okay, diverticulitis is a condition in which you have parts of the intestine which stick out. And sometimes these pockets that develop get infected. And the sticking out part is called a diverticulum. And the infection in that diverticulum is called diverticulitis. And this kills many people. And it is treated, if early diagnosed, it can be treated by antibiotics. But if it continues without treatment, it can develop and cause perforation of the intestine and death of people and require additional surgical. And pain in the abdomen is often an indication that you may have diverticulitis.
How is that diagnosed?
You go to the doctor and they examine you. And then if they examine you and they find you have tenderness, they will then do special x-rays that will pick it up.
My father had it, and he went in for something simple and they diagnosed it. And then they have to, what is it, Dr. Callender, remove a part of the intestine, and then he had to have the bag for a while.
That's right.
And they said, if you follow this diet and do everything we tell you to do, we can reverse it. And I think about 6 months later, they did that, and he didn't have to have the bag any longer.
Yeah, that's you said it well. Precisely. That's what has happened. That's what happened with diverticulitis. Yeah. So any pain like that, you need to let your doctor examine you and find out what's causing it.
Yeah.
Because it's a very serious condition that's killed many people.
David had that too. He wore the bag for a while and they reversed it.
Then, of course, heartburn, which is heart disease until proven otherwise, can be related to gastroesophageal reflux, which is an uncomfortable sensation in your chest, and it has to be diagnosed and treated properly. And there's medication for it that is helpful. But if it's untreated, it can cause precancerous conditions.
John, can you go back to diverticulitis one more time? I wanted to ask Dr. Callender a question. Yeah, diverticulitis, is that in the, that's in the intestines?
Large intestine, yes.
Okay, so is that when the tissue is inverted?
No,
Or-
it's an outpouching of the large intestine, which is called a diverticulum. It goes outside.
Okay, what's the one called that goes inside?
Intussusception is a different situation in which the bowel twists itself around itself. But I don't know any. Now, what you usually have is just an ulcer, which is on the inside of the GI tract, an ulcer. But the outpouching is a diverticulum.
Thank you.
Okay, and then of course, if your abdomen is swollen, that also is significant because that means you have fluid accumulating usually in the abdomen, or it means that you've got an obstruction. And so if you have a large stomach, it does require examination to be sure that it's nothing more serious.
A lot of times that's just beer.
Well, I hope it's just beer because.
How would you know, John?
You know, all these people that drink beer.
Well, they talk about beer belly people,
Yeah, beer belly.
but often they don't realize that some of those people have alcoholic liver disease and they accumulate fluid, and that's why they have a swollen abdomen. So just want to be sure that the swollen abdomen is not a sign of other significant diseases.
Right.
Okay, doctor, for someone that has the fluid in the belly that's not beer because of my liver, you know, I get different messages in regards to cutting back on the fluid intake that I have every day. You know, what's the solution there? Should I, you know, keep up with you know, the normal fluid to put in my belly?
Well, one of the side effects of liver disease and cirrhosis is what they call ascites, which is the accumulation of fluid in the abdominal cavity. And so it sometimes is a sign of cirrhosis. And sometimes it gets so bad that you have to have the fluid removed. But that
Yeah,
is
because you
too
can
often
actually
the
have
case.
2 quarts of fluid in your belly.
That's right. Yeah. And
You
you
know,
can become very uncomfortable and affect the ability to breathe sometimes. So having a big swollen abdomen is not something that you should ignore. It's something you should make sure you are examined and see if your liver is okay, because that is probably among the commonest reasons why you have accumulation of fluid in the abdomen.
Well, absolutely. It happened to my sister, and her stomach continued to swell. And her doctor told her she was getting fat, go on a diet, lose weight. And she was trying, but she was so weak. And this went on for almost a year. And I took her to the hospital center. She had cancer, and it was the ascites. So
Yeah,
certain symptoms you cannot overlook.
right. That's
Just
too bad
stage
that the
3
doctor,
ovarian cancer. Yeah.
right. Too bad the doctor missed it. That's one of
Yes,
the commonest ways that ovarian cancer presents, because
exactly.
again, it's often missed by doctors as well as others.
That's right. They say it's very difficult to diagnose, and definitely her doctor didn't diagnose it.
You're right. Sometimes the doctor tell you you're pregnant, go home.
well, I mean, mine was diagnosed through just sonograms.
Yeah, they now have tests that are not invasive, that they can look at your liver and look in there and tell whether it's just fluid or not, and why, and tell whether you have liver disease or not.
Right.
No long, often it doesn't necessitate a biopsy, because they can do special imaging tests that can tell whether or not your liver is okay. Now, this number 10 is a sign that is something you have to recognize is significant. You eat just a little bit and you feel full. It may mean that your stomach, you got stomach cancer. It may mean that your stomach is not working right. But whatever it is, when you have that, that's a sign that you should not ignore either. Because you can find out why. And one of the things they can do is look in your stomach and see whether it's working right, or whether you have an ulcer, or whether you have a cancer or something, or a tumor. So.
Dr. Callender, on WTOP, I heard yesterday that they have a new pill out that to help you lose weight, you swallow it and expand in your stomach and helps you to eat less. And they haven't, it's not approved yet. It would give these electrical signals to your brain, because it would touch certain parts of your stomach to signal that you're full and don't eat anymore.
Okay, well, it's been interesting to see how that works out. Okay, well, those are the 10 signs that you should be aware of if you have any of those, then you should see your doctor. Now, this is something that we just talked about, the plastic containers. And a lot of people don't realize that these plastic containers have emissions that actually are linked to many other problems, including obesity, diabetes, and heart disease. And this study showed that this concentration of these plastics were a common cause of heart disease. And they called it phthalate exposure. And more and more studies are associated with plastics. And we looked upon plastics as a wonderful thing because no longer glass. Well, the problem is now is plastic is everywhere. And the plastic also has emissions that are getting into our bloodstreams. And it's causing problems. And you can see here that it lost to the phthalates 40 billion and 47 billion. And the price we're paying is our health. And so people are concerned that we're using too much plastic and that plastics are killing us. In addition to being unable to be eliminated. There's a picture on the front of the health section that shows plastic all over the place. So it has been a wonderful boon to eliminating glass, but it's caused another problem in this place. So this is something that we're going to have to work on, just like climate. Now it's the plastics.
Dr. Callender, I heard that it's important to not freeze your water bottle, your plastic water bottle. You know, some people do
Yes.
that. They put it in the freezer so it's nice and cold, but the freezing process releases some of those toxins that you were talking about.
Yes.
Ah,
So what type of plastic? I mean, any type
All
of
kinds
plastic?
of plastic.
So
And
our
then
bottles, our cleaners, everything?
no, plastics. We're talking about plastics.
I know, but okay, our meat comes wrapped up in plastic. They put our vegetables in plastic bags.
You're right. Yeah,
So-
you're right. But I think most of the liquids that we have are in plastics. And
Could it
I
be
think
the plastic water bottles?
the plastic bags are not as much a concern as the bottles.
Okay.
and we
Because
My
the plastic,
grandparents would be amazed at us buying water in bottles. Do you think it
Yeah.
has something to do with everybody drinking water out of plastic bottles?
well, I think we do.
Those
It's
little
not just
flimsy-
water. It's not just water. It's everything.
Oh,
You know,
okay.
most of your bottles of juices and everything, many of them are plastic. So when you
Right.
think about, if you just look at it, everything that you drink, it's probably associated with plastics. And so it's a major problem.
Dr. Callender, how about the leftover food we put in the plastic, containers and put it in the refrigerator for next day to eat? Are they dangerous too, those plastic containers?
Anything that's got plastic has the potential of releasing. It's just that they have not identified which plastics do not have these emissions yet. But it's clear that most of the plastics do have these toxic phthalates that are causing heart disease.
Oh,
Yeah, I would also be aware of putting plastics in the microwave for, reheating things.
yeah.
Sometimes you look at the plastic after it comes out and it may have bubbles in it.
At 11 o'clock in Bowie. I'll call you when I leave there to see whether you're up or not.
Rochelle, there you go. Yeah, so sometimes you take the plastic out of the microwave, it's got bubbles on the surface.
Yeah, yeah.
So that's a chemical change that takes place. So I'd be very cautious about using, sometimes they say microwave safe on
Yeah,
a plastic container.
right.
I would question that, but still.
Well, I think over time, we're going to have to really seriously look at this plastic issue and be able to quantify which plastics are safe, if any, and which are not.
I got the second to the last paragraph, other studies have linked, whatever that word is, to testosterone level in adult men. How? When they use condoms or what? How does plastic?
I didn't understand your question.
See that second to the last paragraph?
Yes.
Okay. How does that, what does plastic have to do with your testosterone level or less? What is,
It reduces testosterone levels in men. So we've had an association with heart disease, and you also have an association with reduced testosterone levels, which of course not desirable.
okay, like is the condoms or that's made out of plastic?
Well, but I don't think condoms would be likely to be the source of the problem. It's likely to be the plastics that are associated with eating products.
Okay, so it's a plastic ingested because
Yes.
like hip replacement and knee replacement, aren't some of those things, there's plastic that they're putting inside human beings?
Well, I don't know any prostheses that they use that are actually plastic. So I'm not familiar with that. But I think the ones that are dangerous are the ones that we're ingesting.
Oh, okay.
Also, you know, in nature, this is a really big deal. Our oceans have patches of plastic floating around on the surface and all the way down to
Absolutely.
the bottom of the ocean. Fish are eating the plastic thinking it's food, and we eat
Oh,
those
my
fish. So that's another source of plastic in the environment.
Yes. Yeah. So it is thought that next to the climate issue is the plastic issue. So it's something that is going to become even more and more important. Of course, the climate change is already number one, but right behind it is the plastic.
So as long as it's not ingested or come in contact with our food, that's what we
Well-
should be aware
Well,
of.
that's the main source of it, but the other problem is that the plastic is everywhere. And so we've got to be able to eliminate the plastics. You know, that picture of that guy in the front of the health section walking over thousands of plastic bottles is just a sign of what happens. As Buchanan mentioned, you find plastic everywhere you go. And so yes, the ingestion is one thing. The other thing is it's just problematic everywhere.
Dr. Callender, the third paragraph sort of sums up my thinking. Our research suggests that the toll of this chemical, and what I look at it, when we talked about putting the plastic in the microwave, which causes a chemical release. When we leave a water bottle in the car in the heat, we notice that, like it was stated, we notice that it creates bubbles. Now, my nephew, when he was in Afghanistan, the soldiers had problems with the water bottle because of the fact that it was causing some digestive problem, because the water was sitting out in the heat and it was causing those bubbles to occur and that chemical release. And so that sums up, when we think about our chemistry class in high school, we think about those chemical release. So anything where that plastic is causing a chemical release is not healthy for our bodies.
Well spoken. Okay. That's tragic news, but now this is another interesting problem that
Yeah.
has occurred. It's something that is well known. It's just that when it affects famous people, it becomes an issue. I've had at least 2 doctors that I know of who suddenly, most often with strokes, and I have one other, a singer who just couldn't talk anymore. And aphasia is the inability to communicate, but it often is complete inability to speak at all. And Bruce Willis's case, he could speak, but only in short and incomplete sentences, and difficulty substituting one word for another. And this aphasia is something that is problematic, and we haven't talked much about it because a lot of famous people haven't had this problem. But it is a problem that often is not after a stroke. Sometimes it completely resolves, and it may go away by itself, and then other times it does not. So it's a condition that isn't as common as you would think. But I think 2 million out of 300 million is small, but still significant. And it's something that we have to be aware of. And when you, for example, one of the doctors I worked with was in a meeting and suddenly stopped speaking.
Oh, wow.
And they had to rush him to the emergency room because they realized he had a stroke. And that's sometimes how it manifests itself. People just can't speak anymore. Aphasia, an inability to communicate. And so when that happens, you have to realize that that patient may have had a stroke. If your whole life is about talking, if your whole life is about singing, then this eliminates your source of livelihood. And so I now have one lady who sang in the choir with us, suddenly developed aphasia. And she's a very good soprano singer, but she can no longer sing or speak. And so this is something, and this is a good idea of what happens with them. They speak, if they speak at all. First they start with speaking in short, incomplete sentences. Then it may progress over time until get to the point that they can no longer speak at all. Have you encountered this in your choirs or singing groups? Any of you? Maya Thorpe, you remember Dr. Gator? He had this. That's how he was in the meetings and he just stopped speaking and they realized that he'd had a stroke. So any of you have other people in your choirs that have this problem?
Dr. Callender, we had some people in the choir. They were kind of old, let's say, in their 70s and 80s. And when they sing, everything is going fine. But then one time when they get to a certain note, nothing comes out. They attributed that to old age.
Well, that's a different kind of aphasia. Only it's for certain notes.
No, not a certain range of notes, but just they were singing and the note wouldn't come out.
Oh, I see. Okay. Yeah.
Dr. Callender, how is Dr. Gaither doing now?
Excellent. He recovered completely.
Praise God. Praise God.
Yeah. He looks just as young as ever. I see him every now and then. Yeah. He's doing well.
Praise the Lord. Praise God.
And this is a good idea. The outlook is variable. Like we mentioned, Dr. Gator had a complete recovery. My singing lady has had no recovery at all, so it varies. But it's a significant condition they have to be aware of. Now, this is something we talked about earlier, but 1/3 of high schoolers report poor mental health during the pandemic. And remember, we talked about this earlier, that particularly in the African-American population, that suicide had gone up dramatically as a consequence of this. And so this is a challenge for our youth and a challenge for our parents and grandparents. And they, just as Carol had mentioned, it helps to be around people who can help pick up when people have suddenly changed their mental health behaviors. This is a problem. Yes.
I'm sorry. Talking about that, teenagers things, I was researching something and I found that this was very minimal among Seventh-day Adventists, Jehovah's Witnesses, and Mormons, because they spent a lot of time with their children, teenagers or little or whatever it is, spirituality, at home things. So it didn't affect them. And they said it's not the friends, it's the family and God. And they spent a lot of time with their kids.
Yeah, well, yeah. So it'd be interesting to actually see a large study of that, because it is certainly affecting a large number of teenagers.
It is. It is.
But isn't it also restricted diet to include that along with that?
I don't know. I haven't seen any data one way or the other as it relates to diet.
Yeah, well, what she just said about those two religion and their connection with family, but those two religion also have restricted diets.
Yeah, they do. They do.
Mhm.
Yeah.
So it's a lot of factors.
Mhm.
Yeah, time will tell. We'll see the studies as they come up to help us, but there's little question that the family interactions plays a part as well as diet. Now, this is an issue that has come up for some time, that
I know.
cell phones and brain
Yeah.
tumors. And in spite of many of the studies, it's still an issue that people still wonder. But the data has not demonstrated a link between cell phones and brain tumors.
Right. Right.
But there's been a lot of speculation.
Right.
But so far, the data does not confirm that speculation.
Mhm.
Who doesn't use cell phones these days?
I was in the eye doctor's waiting area yesterday for my eye exam, and there were like 12 people in there waiting to get their glasses. 12 people were on cell phones, all of them. Crazy. Everybody. And, I was thinking back, 20 years ago, we didn't really have cell phones,
That's
right?
right.
We might have pagers or something like that, the beep
Yeah.
on your pocket, but no cell phones. And now, you go out on a street corner, everybody's on the phone. Nobody's talking to each other.
No.
They're looking at the phone.
Yeah, that's right.
Yeah, and even the couples, they've been walking down the street talking on their cell phone to somebody else.
Right. That's right. That's
It's
why we have
amazing.
so much of disconnect between all the teenagers and all the adults. Nobody's together. Like
Agreed.
Mrs. Tatum was saying, they're not together. Everybody's talking to somebody, and no togetherness in the family anymore.
We need that to come back to that, don't we?
Yes, we do,
Yes.
very badly.
Yeah. Well, anyway, we keep studying and keep studying this, so eventually we'll find out. But so far, no link.
If you go back when they were talking about the UK, okay, the slow growing tumor, the next page up,
Oops, sorry.
they
What did I
gave
do?
us some information on that.
Uh,
Go back one page where it talk about, I didn't finish reading the paragraph, but stop right there. No. Yeah, there it is. In the latest article, the UK research suggests that a likely explanation for the previous positive result is that for a very, very slow growing tumor, there may be detection bias if cellular phone users seek medical advice because of awareness of typical.
Right. But the bottom line is that none of the studies have identified the link yet. So there are many thoughts about it. This is an interesting article about the importance of, we talked about this before, about race being, about glomerular filtration rates being modified based upon ethnicity, which I've always felt was inappropriate. And one of the things that they recognize is that by doing this, Blacks are put at a disadvantage. And so that policy is going to be done away with shortly.
Thank you, God. Thank God.
But that's all related to the fact that we're all one race. And that now we do have different ethnicities and different behaviors in different cultures. And some of this may affect us, but the allegation that because Blacks have more protein, they can tolerate a higher creatinine and glomerular filtration rate is not something that is of value. And so that's going to be eliminated. But for a long time, that was thought to be the state of affairs.
Oh, this is something.
That's interesting. The transgender American issue is something as we, since Obama, the LGBTQ population and the transgender population have gotten more visibility, and the ways in which they have been discriminated against is becoming more and more evident. Prior to this, it was something they did without penalty. Now it's being recognized, although some of the congressional parties are trying to eliminate some of this. But I think appreciating the differences that exist and recognizing that these human differences becomes important.
Dr. Callender, what is the big deal about transgender? Is it like an option? You have both sexes and then you choose one, that makes sense to me. But
well, you have to recognize the difference between gender and sexuality. For example, possession of a penis may relate to your sexuality, but it's not necessarily your gender, because your gender is determined by your mind, so to speak, rather than what organs you possess, whether you possess the ovary or a penis. For gender, it's different, because you have people who are born with penises who decide that they want to become females, and so they get the penis removed and they have surgery to have a vagina. So the difference between sexuality and gender becomes the issue. And so now we're talking about gender. And that's why most of the bathrooms now reflect the ability to male, female, or both, because the difference between sex and gender has become an issue. And you noticed recently that there was that there are many transgender Americans who were killed, and also you saw a man who was changed his gender, who was swimming with the male group and wasn't winning anything, switched over to the female group and he became a winner. And so this then caused people to wonder about the gender issue. And so you're going to have ways in which you differentiate people based upon gender. But anyway, this is people with genders, different genders have rights too. And so the goal is to be sure that people have rights regardless of their gender. Notice we're talking about gender, not sexuality.
Yeah,
Dr. Callender, if you go back up, it said LGBT. They forgot the Q,
They forgot what?
the letter Q.
Oh, yeah, they may have, right.
Yeah,
Doesn't that come interfere with sports and etc.? Because just natural buildup of males from females, you know, the
Well,
testosterone.
it all depends on whether you decide to have a protocol that addresses the gender issue. So I think you need to have a specific protocols that identify hormonal levels as well as other things that differentiate between the genders. And if you don't have that, then you have confusion. And I think until we recognize that and have protocols that identify what is the male gender and what is the female gender, then chaos will remain the situation.
And also,
Dr. Callender, what is the Q?
queer.
Right, queer.
What does that mean?
Means whatever you want it to mean, but it has changed over time. You know, in our era, queer just meant that you were
gay.
yeah, but you were gay, yeah. But now
I don't know what
people have made queer a nice term for saying that you're homosexual. So it's accepted. Before it wasn't accepted. We say queer, that was a bad thing. Now queer is positive.
Yeah.
Queer
Dr.
means
Callender.
you know what the hell you are.
Yeah. Dr. Callender, while you're on this topic, I really feel sad for the Florida children, what the governor has done to them, because many children, in first and second grade, they have parents who are gay, fathers who raise children, and they say, I have gay parents, and they don't, and they're kindergartners, first graders, and second graders, and he's telling them not to say that. So he's hurting the children.
Well, yeah, just because you're a governor doesn't mean you have a lot of sense. It just means you're elected.
Yeah. Yes.
That's the only comment I can make about that.
Yeah, I agree with you.
You're right, it is dangerous. Because we're having more and more children of gay parents.
Right. Mm-hmm.
But our society has done that always, even teachers. They talk about you don't want to be a trash man or work in McDonald's. And if their parents are working that, we sort of denigrate everybody unless they're like us. And the utopia is to be rich, beautiful, and famous. If you're ugly, they discriminate against you and etc. So we in our society, we put certain things down and then we talk about their mothers. What is she, a drug addict or something like that? We don't understand that denigrating anybody, whether their sexuality or what, is detrimental to us. And we become like, I'm not going to talk about that other person. But when we talk about each other, even comedy, that shouldn't be done, period.
Just ask Will Smith.
Yes.
And I think
well, I think it comes down to respect of human and civil rights.
I agree, 100%. Yes.
Okay.
For all.
Yes.
This is an interesting article on our breakthrough of COVID-19, and we've had much of that. It's interesting because there's a lot of talk about the booster shot and the fact if you had a breakthrough infection that you don't need to be vaccinated because you've already gotten, in many ways, the the virus. So therefore that's gives you, that's your booster shot. And so breakthrough infections are occurring. And when they occur, they imbue you with an additional immunization. Here's the difference. The difference is when you've been vaccinated and you get a breakthrough infection, you're not likely to be hospitalized or to die. And as a consequence, you are now hyperimmune. And so that is an aspect of it that we have not addressed previously. And so those people who have had breakthrough infections don't actually need the booster shot.
But they can still spread it though, right?
Well, the point is they've already spread it. In other words, I'm talking about after they've recovered.
Okay.
What I'm saying is, yes, when they get it, they can infect other people. But when they recover, they don't need a booster shot because that has given them hyperimmunity for a period of time.
And that's
After,
with the new variant that's coming out too?
yes, that's a good example is that the people who were vaccinated who developed a breakthrough infection with the new variant, they don't need a booster shot because that has been their booster shot. And so their recommendation is that those people who have had breakthrough infections don't really need a booster shot. So those of you who have not had a breakthrough infection, those are the people who need the booster shot.
Yeah, Dr. Callender, I think this article focuses on the people who have cancer, okay, who had a breakthrough. They said cancer patients have much more serious
Right.
illnesses.
Right, and those people are more likely to die or be hospitalized. And just as you mentioned, this has been problematic and will remain problematic because, as you remember from the studies we did last week, that still about a third of those patients still were unresponsive. So the unresponsive group will still need booster shots.
I'm going to skip ahead, okay?
Go ahead. I just put this in to let you know that people at all levels are dishonest. In science and medicine, every field, there are people who are dishonest. Just like in medical school, we have some students who are dishonest. We have I chair the honor group, and we have people who are dishonest, and we have to deal with them. And so in every group, you get people who are dishonest, and people who try to take advantage of things and fake things. So that integrity is not something that is always present. And this is somebody who got a PhD from the University of Wisconsin, but it doesn't really matter where you get your degree from. It's what's inside. It's the presence or absence of integrity, the desire to get ahead by virtue of dishonesty. And we keep finding this time and time again. And it's so much so that they have a group that actually looks for this kind of dishonesty. And every year we have at least one or two findings of somebody who's been dishonest and does this. So, and ORI is the group that looks at this. and they found 6 episodes of this already.
Oh.
So it's just to keep in mind that at all levels, there's people who try to fake it.
All the way up to the president.
Oh, yeah. Oh, not Biden, though, not Biden. That was Trump.
Not
Trump.
Biden.
Biden is a
45.
good man. It's up for us. Praise
Uh,
God. Praise God.
Yeah. Well, it's interesting that when we look at the COVID, it's an equalizing process. People are affected by it at all levels. And whether you're in the West, the East, it's problematic. And the death tolls, of course, nobody has a death toll like which country?
Us, United
The
States.
United States, right? Because we're approaching 1 million, getting closer and closer to 1 million who died from the virus. And so we're far and away beyond all other countries in terms of deaths from.
We got the freedom to be stupid.
Yeah. Yeah.
That's one way of putting it. One way of putting it. Inequity may be the common barrier. And then, of course, we have those people who feel that vaccinations are no good. So.
Yeah.
This is an interesting point that the official total is, because 6 million is the number that they use that have died globally, but there's some people who say that as many as 18 million. And of course, time will tell what the actual result is. But the absolute test of the effect of the COVID epidemic is actually the mortality rate. And of course, it still doesn't come close to what it was in 1918. But then we have much more advanced scientific advances than they did in 1918. And we've done some unusual things. We've identified the older population and identified them as being more likely to be hospitalized or die. And therefore we treated them separately. Yeah. So. And then of course the other part of it is that you never know how accurate the reports are. And they report one figure and the figure may be under or over.
Especially in communist countries.
Yeah.
Okay, this next one talks about that.
Well, China is a leader in many ways.
It is.
It in many ways it wants to be the leader of the globe, and since the virus first started in China, they have been draconian in their approach to the pandemic, which means they try to do everything to contain it. And
But they're the they people do stuff, and condoms really they don't. So most of them die. They have freedom to decide whether or not they could do something.
Can't understand you.
Oh, what I said is China has total control of their people. They make them do what they want them to. They don't have a choice.
Yeah, that's true. Yeah, and that's the difference between China and the United States. Is that it's not optional.
Right.
I shared before, a friend of mine and his wife were here in the States, and his wife was Chinese. They moved to China to be educators over there, and they made them isolate, what do you call it, in different rooms in a hotel for 14 days before they let them come into the country. They had bought a house over there in China,
They did.
and they had to be
Quarantine.
quarantined for 14 days. They couldn't even see each other. They
Yeah.
couldn't leave the room for 14 days before they even let them in the country. Yeah, they're pretty strict over there.
Yeah.
You look on the street corner, everybody had masks on. Everybody.
Korea is the same way. North Korea was the same. South Korea. Yeah. They take it very seriously.
Yeah, they do. Mhm.
This is, I guess this is kind of going into the full vaccination concept. And this is an effort to recognize that what I mentioned before, the breakthrough infection gives you additional immunity. And that's why somebody who has a breakthrough infection need not be revaccinated within 3 to 4 months because they have high antibody levels.
And Dr. Callender, what you're saying is that the people who have been vaccinated and they had their records to prove that they've been vaccinated. Well, and then these organizations that are asking you to show your proof of vaccination, those vaccination cards are going to expire.
Why are they going to expire?
Because
the vaccination card only tells when you were vaccinated. That's all.
Right.
So it's not going to expire. It's just going to demonstrate the time that you were vaccinated. And also when you get the booster shot, that will be reflected. Now, what the problem is that if you get breakthrough infection, there's no record of that. And you wouldn't need a booster shot. And that's going to be an extra aspect of it that is going to make it difficult to differentiate between the person who's got a booster shot and the person who had a breakthrough infection. But they would both have just about the same immunity.
But Dr. Callender, now the second booster shot they're giving out at Howard. So should we take that second booster shot now? Those who are taken, have taken all three of them.
If you have not had a breakthrough infection, yes.
I didn't have any infection. So
you should have, yes, you should get, you may get the booster shot. I would recommend it. Yeah.
Okay. Did you take it, Dr. Callender?
I'm going to get it today.
Oh, praise God. Where?
At Howard.
Oh, yeah.
The
they give it
vaccination clinic is still there on Tuesdays and Thursdays.
Oh.
9 to 12.
Okay. Up to when, do you know?
It's still open, 9 to 12.
Okay. No, how long? Will this be all through March?
It's open. It's
April.
They have not closed it. It's still open.
Oh my gosh. Okay, I didn't know.
So
That
Thank
is
this
a
is
good
for
sign
this is
when you
the
walk in the
second
hospital.
booster, right?
I'm sorry?
This is the second booster.
Yes.
Yeah, yeah.
Okay.
And mine
I
on Monday.
Yeah, Dr. Callender, I got my second booster at Costco, where I got the first booster.
Okay.
Well, you can get the second boost any way you want now. CVS is giving it now as well.
But
And
if you had
Giant.
Pfizer, you shouldn't take the Moderna, or can we take it?
Say again?
If I had all Pfizer, so I should.
It doesn't matter.
Oh, really? Oh.
No, it doesn't matter. The evidence is that it doesn't matter. The only one where it mattered was the Johnson.
Hmm. Thank you, Dr. Callender, for educating me about it.
And this article is saying what I was talking about earlier, that the booster shot is important for those who haven't gotten the breakthrough. If you have a breakthrough, that's suffices. And that's the area in which, and it's interesting because DC has stopped requiring a booster shot.
What?
They require vaccination, but they have stopped requiring a booster shot. In other words, to work. In other words, if you have one, if you've been vaccinated, you don't have to have a booster shot to work for many places. Now, that's what the DC said. Howard University was requiring booster shot, but I'm not sure if they are listening to DC or CDC. There's some places are requiring a booster shot, but I don't know any that are requiring a second booster shot. So the second booster shot is optional.
Well, I'm getting it.
But I think if you've been over 6 months after your booster shot, you probably can have a booster shot. I think it's appropriate. They say 4 months, so anything longer than 4 months allows you to qualify.
Okay, so John Buchanan, you've had 2 boosters and a breakthrough. So what else do you need?
Well, he got it. He got another booster anyway.
I know, you had a breakthrough and another booster shot.
He's
I think
ready.
I'm real good. I'm
He's
good.
ready. He's ready till next year.
So you're gigging for how many people now?
Oh, hundreds.
Oh, okay,
Hundreds.
so that's why you gigging so much, okay.
No.
Is this the last article, John?
We've got 3 more.
Well, I'm gonna have to leave after this one.
Yeah.
But this is an important one because there's an insulin cap bill that cap insulin at $35 a month because the price of insulin has become ridiculous. And so it's gonna have to go through the Senate as well. But it's clear that this is an important bill because you see this right here. Some places, $2,000 a month for the drug, and that's ridiculous.
That's outrageous.
Oh.
And so the capping it at $35 a month is going to hurt the drug companies, but it's going to help a lot of Americans.
Yeah.
But the point of this article is that this guy is voting against it from Florida.
Yeah, well,
She is. Trump man.
Florida does everything different. And the reason he gave is shocking. He says they should lose weight. Well, I agree. Nobody disagrees with that, but that's not a reason not to support the bill anyway.
Right.
And that doesn't keep you from having diabetes either, does it?
That's right.
No, it doesn't.
No. And that senator, he's one that they're investigating him for trafficking in young girls.
Right.
Yeah.
Right.
Yeah.
Yeah. Mm-hmm.
Okay, well, I'm gonna have to leave, but this isn't a study that shows that ventilation can cut school COVID cases by 82%. And the problem is that most, this is an Italian study,
I
and
know.
most of the Italian schools don't have the ventilation to do it. I don't know, how about our schools here? Do you know, Tatum, if our schools have the ventilation? Or any of you?
No, I don't
They're
think
putting those machines in. They're concentrating on putting in the machines in the classroom.
They have to because when they had windows, kids were throwing books out the windows and everything. So now when they have new schools, they have it so there's very little access to outdoors fresh air. So they got to use machines.
Oh, that's good. Okay. All right. Okay, I'm gonna have to leave.
What are those
Go get
machines
my
called?
booster shot.
Hey,
Hey, Chris, how you doing?
Good on yourself.
Good, good.
Hey,
How's everybody
Chris.
doing?
Hi, Maya.
Hey, hey,
Hi, everybody.
hey. Hey,
Praise
it's
God.
good to see
Nice to
everybody.
see you. Okay. Well, everybody, you take care. Have a good weekend. And it's a great group. We learned a lot today
We did.
Yeah.
and shared a lot. Both. Tell Darryl we missed him today. Oh, there he is.
He's coming in. Give him, Dr. Callender, give him a second. Coming in. Darryl's in.
We missed you,
Where?
Darryl.
We
Hi,
missed you,
Darryl.
Darryl.
Hi, everybody.
Okay,
Oh, there he is. Hi.
Hi, Pearlie.
bye.
Hey,
Bye, everybody.
how are
Have a
ya?
good week. See you later.
Bye-bye.
Thanks again. Hi, Maya.
Hi.
Hi.
I'm so glad you're back, Maya.
Thank you.